As a health-focused organization, our number one goal after disasters is to identify unmet health needs. Then we see if our core capabilities can fill those unmet health needs. We have 4 core capabilities. The first one being leveraging our warehouse and gift in kind product donations. So this means sending hygiene kits, medicines, and medical supplies to trusted health partners on the ground after a disaster. Also, we deploy medical teams. Within the US, we have a mobile medical unit that we can deploy at a moment's notice. And internationally, we're recognized with the World Health Organization as a Type 1 mobile emergency medical team. So we have a roster of over 100 doctors, nurses, and operations volunteers, some in the Kansas City area, but all across the US, that we can call on to deploy medical teams. We also have the ability to support temporary health infrastructure. This typically comes in the form of our portable container clinics. These are 20-foot shipping containers that are then retrofitted to have different specialties, whether it's a primary care focus, an emergency room focus, or even a maternity ward focus. We have 16 of these in Ukraine currently, and they're a great tool to use after a disaster. And finally, we can support with emergency funding to local health organizations. Heart to heart, we don't typically deploy to conflict zones. So in areas such as Sudan, Myanmar, we're able to step in and support local health partners, support their own medical teams through our funding. Every disaster is different, and it all depends on the context. So things that we're looking at as we're building a response is, is a medical team needed? Some of the factors that we look at are, how has the local health system been impacted? Are there staff available on the ground? Can they make it to work, to go to their clinics? Or is their clinic or hospital damaged and they don't have that ability? That's one factor that we'll look at to bring in our medical team. But we're also looking at the overall medical supply chain. Are pharmacies open? Are they stocked? If they aren't, that's when we might pivot and do a gift in kind response where we're sending shipments of medicine and medical aid. So every disaster is different, and our goal is to identify what specific unmet health needs there are, and then how we can best fit in to support that community.